Next, I want to bring up two important labor leaders. Judy Sheridan-Gonzalez, the president of NYSNA, along with Kim Behrens, who's a NYSNA member. Come on up. Thank you, Judy.
So yes, healthcare is a human right. It is not a privilege to be bought and sold in the marketplace. We believe that. This has been a priority for our union for over 20 years, on medical grounds, but also on moral grounds.
Yes.
The for-profit system subjects patients to all forms of abuse. If you're underinsured, you're undertreated. If you have good insurance, you're overtreated. As a clinician, I can tell you that clinical judgment is forced to go out the window. We're victims of a hostile takeover of our healthcare system by for-profit insurers. Clinical control is gone when you have a for-profit insurance model. Care is fragmented into dollar-based structures. The very language of care is altered. We used to divide hospitals' sections into care centers. Do you know what they're called now? Cost centers. Nurses aren't nurses anymore. We're insurance billers. We're tethered to computers. New nurses are forced to be task-oriented, spending hours clicking boxes to ensure patients are charged. The essence of nursing, touching patients, forming intimate relationships with patients, knowing our patients, it's not profitable, so it's not supported. And anyone who's been in a hospital will notice that. And patients aren't patients anymore. They're customers, as if we're selling a product rather than providing a public good. Union members with so-called great insurance find out that their insurance isn't so great. I know that because I work in an emergency room. Their provider, even their hospital, suddenly is out of network. Their insurance doesn't cover a procedure or a treatment or a medication, and then they're forced into a therapy that they know isn't going to work because the insurance demands it. And what are the outcomes? Illness, injury, complications, and death, even for the insured. Patients with heart disease cut their pills in half and end up with a stroke. Women with fibroids wait months for ultrasounds and specialists or coverage, only to lose their uteruses, can't have children, bleed to death, or die from cancers that could have been avoided. And we see this with the insured. Patients with mental illness, they're discharged in a breakneck speed because that's the policy of the insurance company. And what happens the next time in my ER? They come back with an attempted suicide and an overdose, or a successful suicide, and then they're DOA. Even simple things, and this is just one story out of many. I had a patient came into my ER with a bee in her ear. The bee died as we were trying to remove it, but we were unable to remove it because you need the special equipment from the ENT department. But it was not considered an emergency once the bee died, so she had to be charged the full emergency room fee. Once a bee is dead, according to the insurance company, it's not an emergency. Anyone ever have a bee in your ear? I think that's an emergency. So we tried to send her to the specialist ENT clinic, but because it wasn't an emergency, they wouldn't give her an immediate appointment, so we couldn't send her there. We found one across town that would take her, so she called up to go, but they didn't take her insurance. So after hours in the ER with part of a bee left in her ear, she walked out. I don't know what happened to her. And we never know what happens to people who are in that kind of situation. And that is only one story. We know the uninsured and the underinsured suffer, but be aware. Even public workers who think they're well insured, they suffer too. We give up wages and pensions for health care when we're bargaining. Truly excellent health care is a myth for the average worker in the United States and certainly in New York. Having insurance is better than not having it, but it can easily result in misses, errors, oversights, and deaths. The New York Health Act, removing the profit motive, it won't stop all errors, but it will level the playing field for patients and for providers. So we, who care for the sick, focus solely on their care. Do what we're taught to do what's in our hearts to do. Bringing back honor to the profession, health and stability to the population, especially during disasters. COVID taught us this much preparation for pandemics is not profitable, and the lack of preparation resulted in unnecessary deaths of countless patients and caregivers. We're better than that. We all deserve better than that. Healthcare is a human right. Pass the New York Health Act. Yeah.